Hello, I'm Peg Bulgioni, Communications Specialist with Rutland Regional Medical Center, and I'd like to welcome you to Window on Wellness. The focus of our program will be on sepsis awareness, including the causes, risks, and treatment. I will be interviewing Samantha Helinski and Andrea Wicher, who are representing the Rutland Community Collaborative. Later in the show, we will be hearing from community provider Dr. Peter Hogenkamp and hospital medicine specialist Dr. Rick Hildebrant. We will return to the program after this message from Rutland Regional Medical Center.
Welcome to Rutland Regional Medical Center. We are Vermont's largest community hospital with 37 specialty clinics. Healthcare organizations have always fixed people once they're broken, but at Rutland Regional Medical Center, we do more. We provide nutrition counseling, weight loss help, smoking cessation classes, all the things that help the community and individuals stay healthy. And we do it all with this promise, to listen, to respect, and to care, always.
Welcome back to our show. I'm very pleased to be joined by Andrea Wicher and Sam Helinski. They are with Rutland Regional Medical Center, but they're actually here today on behalf of the Rutland Community Collaborative. And we will be talking about sepsis awareness today and the role that the collaborative is playing in trying to just get the messaging out there to the community about what sepsis is, what the risks are, and so forth. So I think we're going to start with Andrea. And can you provide us with a little background about how this all got started?
Sure. As you said, I've been involved in the collaborative now for about 2.5 years, and I function primarily as the project manager. So the collaborative itself started back in 2011 as the Congestive Heart Failure Collaborative, and over the years has transitioned into the COPD Collaborative and then transitioned into the All-Cause Readmission Collaborative to what we have now is the Rutland Community Collaborative, where it's focused on, it chooses a clinical focus for the community across the entire healthcare continuum. So it includes skilled nursing facilities, the hospital, it includes home health agencies and homeless prevention centers. So it's meant to cross the continuum, primary care as well. So we are now at a point where we were trying to decide what direction to go in. And previously we had direction from the state as part of the collaborative. So after looking at some data, we found that sepsis was one of our #1 reasons for patients getting readmitted to the hospital. So we, after looking at that further and deciding whether or not this is a feasible task, we said, well, if this is the #1 reason that patients are falling ill and having to come back to the hospital, we decided that how could we be better about doing this throughout the entire community as well as other entities within the community. So we decided that our overall mission was going to improve the overall health of the Rutland community through appropriate utilization and access to healthcare services across the continuum. So that brings us to our #1 goal this year, which is to reduce the number of patients getting readmitted with sepsis.
And I know you had mentioned earlier about the makeup of the collaborative, and it's very diverse.
Yes.
And so how many approximately are part of it?
I would say over 30 organizations, about, maybe even 40. Okay. It keeps growing every day.
Well, and I know that you have certain buckets that you're focusing on as well, aside from sepsis, but I know that seems to be at the forefront.
Yes, so that is at the forefront, but within the collaborative itself, so we have a monthly stakeholder meeting where everyone is invited, including we're trying to get more community members involved who are non-healthcare, who are not associated with a healthcare organization. But currently we have 6 subcommittees, and the 6 subcommittees are the Behavioral Health Committee, so it's focusing on behavioral health in the community. Then we have Education Engagement Committee, which is right now working on the sepsis awareness piece. Then we have Transitions of Care, which is focused on how people are getting transitioned from one organization to another, or one level of care from another. then we have the data committee, who is working on data to present to the entire community that allows people to look at other people's data, or other organizations can look at other data, so that way we know that we're making improvements to the overall health of the community. And then we have the Palliative Care and Hospice Committee, which is focused on ensuring that we're doing the same thing across all care settings as well, focusing on how are we helping people as a community make better plans for end of life, or just their overall plans for palliative and hospice in the future. So, yeah.
All right, that's great. So I think we need to sort of redirect things back to sepsis. And so Sam, maybe you can share with us general information for our viewers, who's at risk, the causes, because I think it's just something that people have heard of, but they don't really know much about. So why don't you start?
So as Andrea was explaining, we identified at the collaborative level that sepsis is something that's impacting our community, and to address it properly, we really need to include everybody from our community who provides healthcare and support services, so that we can support patients going through this on a holistic continuum. So by including primary care, the hospital, the skilled nursing facilities, level 3, pharmacies, anyone who may touch a patient in their journey to recovery, or wellness in general, we identified it as our primary goal this year to at least provide sepsis awareness. And through providing awareness, we give every person the opportunity to help prevent sepsis. And what this also does is it helps to help us tune into what it is and how we can best prevent sepsis in our community. So as one of the co-leaders of the Engagement and Education Committee through the collaborative, we were able to come up with an education, and we're calling it the Sepsis Journal. And all of the information for this journal came from sepsis.org, which is the Sepsis Alliance, which is a non-for-profit company or organization, which provides up-to-date, evidence-based, trustworthy information, which really was all pretty much developed and put into this journal from that resource. So certainly for most up-to-date information, testimonials, and videos, please go visit sepsis.org. But what we do is we took an approach in our journal to talk about 4 main components. The first component is, what is sepsis? Sepsis is your body's response to an infection. And it's not a specific infection. It could be a urinary tract infection, it could be pneumonia, it could be a wound infection, it could be the flu. Many people become so ill with the flu that their body develops either a respiratory infection or some other type of infection, which then builds up sepsis as a reaction to that infection. Everyone's at risk for sepsis. It can happen through the entire lifespan. The most at risk are the very young and the elderly, or people who have chronic disease. If you have diabetes, or you have congestive heart failure or COPD like Andrea mentioned, or people who have had recent surgery, your immune system is weakened and you could be at more risk for developing these symptoms. How you prevent sepsis is by taking care of yourself, eating right, exercising, following the instructions that your healthcare providers give you to maintain your best health. Hand washing helps to prevent infection. It helps to keep you well. If you get a scrape or a cut, washing it out, covering it with a clean dressing, paying attention to what it looks like and that it's healing is very important as well. Getting your vaccinations, keeping them up to date. If you get your flu shot in the fall, it lowers your chance of getting the flu or other infections. And if there is something wrong, seeking medical attention earlier rather than later is very important. And then we talk about some of the symptoms. Certainly, the symptoms of sepsis follow those just like you would for an infection. Do you have a fever? Are you shivering? Do you have cold chills? Do you have extreme pain or general discomfort? Are you short of breath? Are you not feeling well? Those are all symptoms that you want to pay attention to and seek medical care for. When you are ill, whether you're being treated out in the community by your primary care or you're in the hospital, you want to do everything you can to take care of yourself to recover. You want to eat well, you want to stay hydrated, you want to make it to your doctor's appointments, you want to be able to take your medications as prescribed. Those are all very necessary to do to keep yourself healthy. And when you're recovering from an infection of any type, not only sepsis, but any infection, it does take time. Your body needs to heal itself. It needs to recuperate from the time that you need to recuperate.
That's okay. That's all right. That's exactly what people need to hear, so that's fine. And it's not contagious, though.
No, sepsis is not contagious.
All right.
However, when you have an infection, you do need to wash your hands. People visiting you need to wash their hands. If you're coughing or it's a respiratory infection, you certainly need to follow your healthcare provider's advice on not coughing in somebody's face or minding how you take care of your tissues and things like that. Good overall hygiene is very important.
I think that what seems to be very illuminating to me is the fact that it's the third leading cause of death in the United States.
Yes.
I don't think people are even remotely aware of that. And that's a glaring statistic.
Sepsis tends to be underreported because many times people have other health problems and the sepsis occurs later in somebody's illness.
Which is why, after looking at the data, it took such a large amount of data to be able to see this trend.
Right. Right.
And our intention is not to scare people. We do not want to incite fear upon anybody.
Right.
We are just trying to give awareness to our community so that you can access sepsis.org and look at those videos so that you can take better care of yourself. We want you to feel empowered, and we want you, when you get a blister, we want you to take care of it. Keep your skin clean, keep it dry, protect open areas. If you're sick, we want you to see your healthcare provider, and most importantly, follow the recommendations of your healthcare provider.
Welcome to Rutland Regional Medical Center. We are Vermont's largest community hospital with 37 specialty clinics. Healthcare organizations have always fixed people once they're broken, but at Rutland Regional Medical Center, we do more. We provide nutrition counseling, weight loss help, smoking cessation classes, all the things that help the community and individuals stay healthy. And we do it all with this promise: to listen, to respect, and to care, always.
Welcome back to our show. I'm very happy to have with me as my guest Dr. Peter Hogenkamp, a primary care provider, and we're going to be continuing our discussion around sepsis and sepsis awareness. So Dr. Hogenkamp, welcome to the show.
Great to be here.
Yeah. So I guess we're going to get right into it. So as a physician, how do you evaluate for sepsis?
As I think we've discussed, sepsis starts with an infection, but it's more than an infection. Sepsis is basically the effect that an infection has on your body. And usually that means a decrease in organ perfusion. So when patients come in, and I'm concerned they might be septic, I look for signs that the infection has caused decreased organ perfusion. And now that's the first thing we look at is skin. When a patient comes in and they may be septic, their skin is often mottled. That's because the skin isn't getting enough blood. So instead of that nice healthy pink that we normally see, the skin tends to look blue. If I pinch the skin, what should happen in normal skin is that the skin will blanch, become white, and then it'll fill right back up with blood as those capillaries are perfused with blood. In a patient who might be septic, the skin stays blue, and that's something we look for. One of the most common things we look for is a change in mentation. So your brain is also affected by lack of blood. So when the brain doesn't get enough blood in a septic situation, patients oftentimes have confusion. Their mentation change, something we call change in mental status. I've seen people who've had hallucinations when they're septic. Oftentimes we see paranoia, all kinds of things like that. Basically we're looking for a change in how somebody is thinking. Another real common cause of or a sign we look for with sepsis is decreased urine output. The kidneys are basically a big blood vessel. So in sepsis, where there isn't enough blood perfusion to the body, the kidneys actually don't get enough blood, and therefore they don't make enough urine. So if a patient comes in, particularly when we're looking for kids, obviously you can't talk to a kid. If they're not making urine, that's something that we find very worrisome as well. Any evaluation of a patient always starts and ends with history. And basically history just means asking patients questions. So we're looking for a history of cough, which might indicate pneumonia. Pneumonia is a very common cause of sepsis. We're looking for rashes. Rashes such as might occur in a cellulitis, or if somebody gets an animal bite or a nick or something like that. Oftentimes that rash can indicate that there's an infection in the skin. Skin infections are also a very common cause of sepsis. We're looking for travel history, interestingly enough. If a patient has come back from a place where their infection is predominant, for instance, when people were traveling down south, we were looking for, down to the Caribbean that is, we were looking for Zika virus. If patients comes back from the Midwest, where histoplasmosis, which is a fungal infection, I'd just like to make the point that we often think that sepsis can only be caused by bacteria, and it most often is. But in some settings, it can be caused by fungus. It can be caused by viruses as well. Some cases, it can be caused by parasites as well. Getting back to the histories, as I was talking about, a history of a bite. Interestingly enough, the three most common bites that we see troubles with are cat bites. Cat bites actually happen to be can be very dangerous. Dog bites and human bites. Of the bites that get infected and can cause sepsis, probably human bites have the highest percentage of that. We don't see them that very often, fortunately. So we're looking for a history of bites. As I mentioned, a history of travel. We're also looking for a history of urinary issues. Mm-hmm. The third most common cause of sepsis would be starts with the urine system. So when patients come in, if they're having pain when they urinate, or if they're having difficulty urinating, that's the type of thing that we're looking for as well.
Is that, as you're relating about the symptoms, is that usually your first, I say, line of defense, or the first thing that you look at if somebody does present those symptoms? Is whether they might possibly have sepsis?
Yeah, we're always going to start off with the history kind of thing. And if the history starts looking good for, or not looking good, but looking positive for sepsis, then we go to a laboratory evaluation. Mm-hmm. So we might order x-rays, like a chest x-ray, which could show pneumonia. We're looking at urine specimens, which might show bacteria in the urine. We're looking for a blood count. We'll check a complete blood count. That might show either a high or a low blood count. Interestingly enough, oftentimes we associate high white counts with infection, but in sepsis, oftentimes we see a low white blood count. And that's because the infection is so overwhelming to the bone marrow that the bone marrow actually produces fewer white blood cells. We can also see on a chemistry profile, we can also see effects on the liver function, and as I mentioned, on the kidney function. The kind of gold standard of diagnosing sepsis would be a blood culture. And that is, if we see bacteria in the blood, that's kind of paradigmatic for a sepsis.
Okay. So what are your recommendations for treatment and for aftercare?
Excellent. So I always recommend inpatient treatment for sepsis. One of the things that we try to do nowadays is we try to treat people as an outpatient, which means in the office to keep them out of the hospital. But sepsis is one of those things, by definition, not only is it an infection, but it's an infection that causes end organ problems. So patients need the support and care that's offered by our hospital. In terms of aftercare, I think that's very important because people get admitted to the hospital nowadays and they're discharged as soon as we can, because hospital care is expensive. There are other problems that are associated with being in the hospital. But what patients have to realize, and I think sometimes they don't, is that patients aren't 100% improved when they're leaving the hospital. They're improved enough to go home. So what we want them to do is to see their primary care doctor as quickly as possible. We want them to take all of their medication. Oftentimes I see patients who've taken half their antibiotics. As soon as their fever's gone, they stop taking them. Or as soon as they're feeling a little bit better, they stop taking them. That's not what we recommend. The last thing that I would mention is if the patient has an appointment with me next week and they've been discharged from the hospital and they're starting to see a return of their symptoms, in particular a return to fever, a return to cough if they had pneumonia, a return to urinary problems if they had a urinary tract infection, if they had a cellulitis which led to their sepsis, which is an infection of the skin, if that rash starts to get worse, give us a call. Don't wait until you come to see me. Oftentimes people will call and they say, I was discharged from the hospital 2 days ago, and I'll tell my nurse, just get them in right away. So it's important that the patients call.
And so I guess as sort of a final takeaway, what are some other things that you would just recommend for people to be vigilant about this?
Well, I'm going to put a plug in for vaccinations because, as sepsis starts with an infection, any vaccinations that we can have to prevent infection in the first place is a great idea. And that includes, obviously, flu shots. But we also have a number of pneumonia shots nowadays. We have a shingles shot out now that's very effective. We oftentimes see skin infections start with something like the shingles. We have meningitis shots, which are especially important for children and adolescents.
All right. I think that's probably
that's
it.
Pretty much what I wanted to tell people.
Okay.
Thank you very much for having me.
Well, thank you very much. It was a pleasure.
Cheers.
Welcome back to our program. We are talking about sepsis awareness, and I'm happy to have Dr. Rick Hildebrant, hospital medicine specialist, with me here today to give us his perspective on sepsis and prevention, treatment, etc. Welcome, Dr. Hildebrant.
Thank you.
So as an inpatient doctor, you see many cases of sepsis annually, but I know that many patients and families don't really understand what it is, so perhaps you could explain it to us in as simple a term as you possibly can.
Sure. So sepsis, basically speaking, is when an infection overwhelms the normal defenses of the body and causes organ impairment. That's sort of the hallmark criteria in sepsis, is that it's not just a localized infection like a head cold or a urinary infection, but it causes impairment in a different organ.
Okay. Could you maybe elaborate a little bit more on that?
Sure. So a common scenario that many people have experienced is they have a routine cold, and that's a very common thing that many people have. That can decrease our ability to fight off infections, especially respiratory infections, lung infections. That's a setup for many people to get a pneumonia, which again is a simple infection. It's contained within the lungs. It's a bacterial infection of the lungs typically. It can also be a viral infection of the lungs. If a pneumonia were to cause the systemic response, including very high fevers, low blood pressure, where people would commonly feel lightheadedness or dizziness, that can lead to impairment of a variety of different organs, such as impairment of the brain, which can cause disorientation or confusion, impairment of the cardiovascular system, which can cause people to pass out. It can cause uncontrollable shaking and chills. It can cause people's kidneys to stop working and they don't make normal amounts of urine. And when that occurs, then we call it sepsis. It's not just an infection in the lungs, but it's caused a response that has impaired other organs in the body.
So how do you get patients to really pay attention to this? Because, I mean, the symptoms as you present them might be a little confusing. So what are the real signs that people should pay attention to and get treatment right away?
Sure. So whenever someone has really serious symptoms of sepsis, we would look out for things such as, again, very high fever. So fevers over 103 degrees Fahrenheit in an adult. Under that can be a normal response. People with a run-of-the-mill cold can have a low-grade fever of 102, but if it gets to be over 103, that's a little more troublesome. People have uncontrollable shaking chills where they just can't get warm. That's the body's natural response to try and raise their temperature, but if it doesn't achieve its goal, people will get these things called rigors. The lightheadedness, but the type of lightheadedness that doesn't go away. So it's very common for people to have something called orthostasis, which is when you stand up, you can get lightheaded for a period of time. That happens for a variety of reasons. But if that were to persist with sitting or to not go away, that could be an indication of low blood pressure. Trouble breathing is another very concerning symptom. So people can't catch their breath, which is not typical for them. That would be a very concerning thing. And then, of course, confusion or disorientation that persists would be another very concerning symptom that people should watch out for. Many times, the people themselves don't realize that they're having these symptoms. It's loved ones that notice them in their family members. And if you do have a family member where you notice that they have these constellation of symptoms, it's very important to seek medical attention immediately.
So what measures are taken in the hospital if somebody presents with sepsis?
The first and most important thing is to identify it as sepsis rapidly. As with all patients who come into the emergency department, we would start with a physical exam and a history. Those are the most important things in all medical encounters. Vital signs can be very important in telling whether someone has sepsis. Laboratory evaluation, usually blood tests, and then oftentimes some type of imaging, usually an X-ray, to see if there's an infection somewhere in the body. That routine exam can identify whether someone has sepsis or not rapidly. When it's identified as sepsis, the most important thing is the rapid administration of antibiotics. Of the many studies they've done with sepsis, that is the one thing that very clearly improves patient outcomes. The other thing that we will often do is to support someone's blood pressure with intravenous fluids. So with sepsis, the sort of hallmarks for early sepsis for treatment are antibiotics, again, generally intravenously, and intravenous fluids.
And so what advice do you give to people to help stave this off?
Sure. So the risk of sepsis in healthy individuals is relatively low. Most people who get infections do not develop sepsis. The populations of individuals who do are those who are very young, very old, have multiple chronic comorbidities such as heart disease or diabetes, and those with impaired immune systems, either acquired or something they were born with. For the healthy individual, the most important thing is to stay healthy, to live a healthy lifestyle, to live a life free of drugs, free of excessive alcohol, free of smoking, exercise regularly, avoid high sugar foods, follow up with your doctor for routine checkups, and very important to get your vaccinations as they're recommended, specifically for influenza and pneumonia. Another thing that's also important is to wash your hands frequently, especially when you are in the community, meeting others, shaking hands. During cold and flu season, washing your hands can be a very effective means to prevent yourself from getting an infection. Sleeping well at night is another thing. Keeping yourself and your body healthy will prevent you from getting sepsis.
Thank you for joining us today. Please continue to watch Window on Wellness each week on PEG TV Channel 15 and also on demand at pegtv.com.